Antipsychotic medications. It improves the thought process and the behavior of the client with psychotic symptoms, especially clients with schizophrenia. Antipsychotics are used for schizophrenic patients. Mainly two types of antipsychotics: typical antipsychotics and atypical antipsychotics. Typical antipsychotics are flufenazine, haloperidol. Atypical antipsychotics include clozapine, quetiapine, risperidone, and ziprasidone. Typical antipsychotics are more effective for positive symptoms of schizophrenia such as hallucinations, aggression, and delusions. Also, it can produce an antiemetic effect also. Atypical antipsychotics are more effective for negative symptoms of schizophrenia such as avolition, apathy, and alogia. The effects of antipsychotic medications are potentiated when given with other medications acting on the central nervous system. Antipsychotics have mainly two types of side effects: anticholinergic effect and extrapyramidal side effects. Anticholinergic effects include dry mouth, increased heart rate, urinary retention, constipation, and hypotension. Extrapyramidal side effects include Parkinsonism, in that tremors, mask-like faces, rigidity, shuffling gait, dysphagia, and drooling of saliva. Other extrapyramidal side effects are dystonia, abnormal or involuntary eye movements, that is oculogyric crisis, facial grimacing, twisting of the torso, akathisia, restlessness, and constant moving about. Tardive dyskinesia, protrusion of the tongue, chewing motion, involuntary movements of the body and extremities. Other side effects are drowsiness, blood dyscrasias, pruritus, photosensitivity, blood glucose level is elevated, increased weight gain, and impaired body temperature regulation, gynecomastia, lactation. Extrapyramidal syndrome. It is associated with antipsychotic medications. Include Parkinsonism, dystonia, akathisia, tardive dyskinesia. In Parkinsonism, tremors, mask-like faces, dysphagia, drooling, rigidity, and shuffling gait. Dystonia includes facial grimacing and oculogyric crisis. Akathisia, restlessness, constant moving about. Tardive dyskinesia includes protrusion of the tongue, chewing motions, and involuntary movement of the body and extremities. Interventions for patients taking antipsychotic medications include monitor for vital signs and check for the symptoms of neuroleptic malignant syndrome, which can occur with antipsychotic medications, and monitor urine output and serum glucose levels. Clients taking antipsychotic medications may require long-term medication for Parkinsonian symptoms also, and liquid medications are preferred. Protect the liquid concentrate from light and dilute with fruit juices. Always taper the dose and then only gradually discontinue. Otherwise, it can cause psychotic symptoms. Neuroleptic malignant syndrome. It is a potentially fatal syndrome that may occur at any time during therapy with neuroleptic medications, that is antipsychotic medications. Neuroleptic malignant syndrome is manifested as dyspnea, tachypnea, tachycardia, irregular pulse rate, fever, high or low blood pressure, increased sweating, loss of bladder control, skeletal muscle rigidity, pale skin, excessive weakness and fatigue, altered level of consciousness, seizures, severe extrapyramidal side effects, difficulty swallowing, excessive salivation, oculogyric crisis, and dyskinesia, and elevated WBC, liver function results, and CPK. Interventions include notify the physician, monitor vital signs, initiate safety and seizure precautions, prepare to discontinue the medications, monitor level of consciousness, administer antipyretics as prescribed, use a cooling blanket to lower the body temperature, monitor electrolyte levels and administer fluids intravenously as prescribed. Intramuscular injections are absolutely contraindicated in clients with neuroleptic malignant syndrome.